When Sarah walked away from the only community she had ever known, she couldn't have predicted the profound changes occurring inside her brain. As a former Jehovah's Witness facing complete social isolation through institutionalized shunning, her neural networks were rewiring themselves in ways that neuroscience is only beginning to understand. The human brain's remarkable capacity for change becomes both vulnerability and salvation when individuals exit high-control religious environments. Leaving Jehovah's Witnesses creates measurable neurological changes across multiple brain systems, involving stress response dysfunction, social pain network activation, and identity reconstruction processes that parallel complex trauma. Yet the same neuroplastic mechanisms that enable indoctrination also facilitate recovery and psychological growth. The neurobiological impact represents a unique dual trauma: prolonged psychological indoctrination combined with complete social network loss through institutionalized shunning. This creates cascading effects across interconnected brain systems that extend far beyond simple stress responses. Research demonstrates that religious beliefs emerge from complex interactions between three primary neural networks. The default mode network handles self-referential processing, the frontoparietal control network manages cognitive flexibility, and the salience network detects emotional significance. When individuals leave high-control religious environments, all three systems require fundamental reorganization, creating a neurological perfect storm that helps explain the profound psychological distress experienced by former members. Cortisol dysregulation represents one of the most consistent neurobiological findings in religious trauma research. A landmark 10-year longitudinal study of 1,470 adults found that religious struggle significantly predicts flattened diurnal cortisol slopes, indicating disrupted hypothalamic pituitary adrenal axis functioning characteristic of chronic stress disorders. This pattern of hypocortisolism with enhanced negative feedback sensitivity mirrors findings in complex post-traumatic stress disorder populations. The stress hormone cascade creates lasting brain changes through multiple mechanisms. Chronic cortisol elevation initially damages hippocampal neurons, reducing this region's capacity to regulate the stress response system and process contextual memories. Simultaneously, elevated norepinephrine creates persistent hyperarousal states, manifesting as exaggerated startle responses, hypervigilance, and sleep disturbances commonly reported in former Jehovah's Witness populations. Research shows trauma patients with childhood experiences display cortisol levels 60% higher than normal, and 122% higher when exposed to additional stressors. This pattern explains why leaving religious communities often triggers such intense psychological distress. Neuroimaging studies reveal specific brain regions show volumetric and functional alterations following religious trauma. The hippocampus, crucial for learning and memory consolidation, shows volume reductions of 5 to 26% in trauma survivors, with decreased neuronal integrity markers correlating directly with cortisol levels. This hippocampal damage impairs contextual memory processing, contributing to intrusive traumatic memories and difficulty integrating past experiences coherently. The amygdala demonstrates both structural and functional hyperactivation, creating an overactive threat detection system that persists long after leaving the religious environment. Functional magnetic resonance imaging studies consistently show heightened amygdala responses to religious stimuli in trauma survivors, alongside reduced connectivity with the prefrontal cortex, the brain's executive control center responsible for emotional regulation and rational decision-making. Prefrontal cortex dysfunction emerges as particularly significant given its role in critical thinking and cognitive flexibility. Research on veterans with penetrating brain injuries found that damage to the ventromedial prefrontal cortex correlates with increased religious fundamentalism, suggesting this region normally modulates rigid belief systems. In religious trauma survivors, chronic stress leads to prefrontal hypoactivation, manifesting as impaired decision-making, reduced impulse control, and difficulty challenging indoctrinated beliefs. The neuroscience of shunning reveals why social rejection feels literally painful. Comprehensive analysis of social exclusion studies demonstrate consistent activation in the dorsal anterior cingulate cortex and anterior insula during social rejection, the same regions that process physical pain. This social-physical pain overlap explains why former Jehovah's Witnesses often describe family shunning as physically agonizing. Default mode network hyperactivity emerges as a compensatory mechanism during social isolation. Studies of approximately 40,000 participants found that loneliness-linked neurobiological profiles converge on the default mode network, with lonely individuals showing larger gray matter volumes and stronger functional communication within these regions. This network upregulation appears to support mentalizing, reminiscence, and imagination, essentially the brain working overtime to simulate social connections that no longer exist. The systematic nature of psychological manipulation within Jehovah's Witness communities creates particularly severe neurological disruption. The organization's comprehensive control mechanisms target multiple aspects of cognitive and social functioning simultaneously. Information control restricts access to outside perspectives, creating epistemological dependence where members lose the ability to evaluate truth claims independently. Thought control through doctrine and ritual creates rigid mental schemas that resist contradictory evidence. Emotional control through guilt, shame, and fear produces chronic stress states that damage critical thinking regions. The doctrine of disfellowshipping represents perhaps the most neurologically damaging aspect of the Jehovah's Witness system. Unlike other forms of social rejection, disfellowshipping involves complete severance of all meaningful relationships simultaneously. Family members, lifelong friends, romantic partners, and community connections disappear overnight. This creates what researchers term social death, a condition that activates the same neural pathways as physical mortality threats. Brain imaging studies of social rejection using the cyberball paradigm demonstrate specific patterns of neural activation during exclusion. The dorsal anterior cingulate cortex, which processes both physical and social pain, shows intense activation during rejection experiences. The anterior insula, responsible for interoceptive awareness and emotional salience, becomes hyperactive as the brain struggles to process the magnitude of social loss. These regions remain hyperactivated for extended periods following disfellowshipping, creating chronic pain states that can persist for years. The timing of religious exit significantly impacts neurological outcomes. Individuals raised from birth within Jehovah's Witness communities show more severe neurological disruption than adult converts who leave. This occurs because childhood religious indoctrination coincides with critical periods of brain development when neural pathways are most malleable. The developing prefrontal cortex, responsible for executive function and critical thinking, becomes organized around religious frameworks during these sensitive periods. Gender differences in neurological impact reflect the patriarchal structure of Jehovah's Witness communities. Women experience additional layers of psychological control through gender-specific doctrines that restrict education, career advancement, and leadership opportunities. These restrictions create learned helplessness patterns that become neurologically embedded through repetitive reinforcement. Female ex-members show higher rates of depression, anxiety, and post-traumatic stress symptoms compared to male counterparts. The neurobiological basis of learned helplessness involves dysregulation of the locus coeruleus norepinephrine system and dysfunction in the ventromedial prefrontal cortex. Chronic exposure to uncontrollable stressors creates neural adaptations that generalize beyond the original context. Women leaving Jehovah's Witness communities often struggle with decision-making and self-efficacy due to these embedded neural patterns of helplessness. The specific mechanisms of memory consolidation disruption in religious trauma create lasting cognitive effects that extend far beyond initial exit periods. When individuals undergo disfellowshipping, the sudden loss of social context disrupts the neural processes responsible for episodic memory formation. The hippocampus relies heavily on environmental and social cues to properly encode and retrieve memories. When these contextual frameworks disappear overnight, many ex-members experience what researchers term biographical disruption, where entire life periods become difficult to access or feel disconnected from personal identity. This memory fragmentation occurs through stress-induced alterations in neurotransmitter systems. Chronic elevation of cortisol interferes with acetylcholine function in the hippocampus, disrupting the neural oscillations necessary for memory consolidation during sleep. Many former Jehovah's Witnesses report years of insomnia and disturbed sleep patterns that compound memory difficulties. The phenomenon of spiritual injury represents a distinct category of psychological trauma that creates unique neural signatures. Unlike other forms of trauma that typically involve external threats, spiritual injury involves the collapse of meaning-making systems that provided existential security. Neuroimaging studies of individuals experiencing spiritual crises show activation patterns distinct from other trauma types, particularly involving the temporoparietal junction and posterior cingulate cortex regions associated with self-transcendence and meaning-making. Language processing undergoes significant changes during religious indoctrination and subsequent exit. The left hemisphere language networks become organized around religious terminology and concepts, creating what researchers term loaded language effects. Specific words and phrases trigger intense emotional responses long after leaving because they activate entire neural networks associated with religious trauma. Former members often report visceral reactions to biblical terms, hymns, or organizational vocabulary years after exit. The same neuroplastic mechanisms that enable religious indoctrination also facilitate recovery. Revolutionary research demonstrates how repetitive religious messaging creates rigid neural pathways through use-dependent plasticity, but these same pathways can be rewired through targeted interventions and new experiences. Scientists have identified a specific brain network associated with religious fundamentalism, a right hemisphere lateralized circuit involving the orbitofrontal cortex, dorsolateral prefrontal cortex, and inferior parietal lobe. Identity reconstruction involves systematic neural network reconfiguration. Brain imaging studies reveal that belief revision activates different regions than initial belief formation. Belief states show greater ventromedial prefrontal cortex activation for self-representation and emotional associations, while disbelief states activate the superior frontal sulcus and precentral gyrus. During recovery, individuals must essentially rewire their self-referential processing systems within the default mode network. Neurobiological recovery follows predictable phases with distinct neural signatures. The immediate phase, spanning 0 to 6 months, involves acute stress responses and initial cognitive dissonance, characterized by heightened brain activation during social rejection processing. The transition phase, lasting 6 to 24 months, shows active neuroplastic remodeling with measurable increases in cognitive flexibility scores and enhanced brain network integration. Long-term recovery produces quantifiable brain improvements. Hippocampal volume increases of 2 to 3% during identity reconstruction reflect new neuron growth and enhanced memory processing capacity. Fundamentalism scale scores show significant decreases as dorsolateral prefrontal cortex function strengthens, enabling greater cognitive flexibility and evidence integration. Religious trauma syndrome represents a distinct neurobiological phenomenon requiring specialized intervention approaches. Research on 424 former Jehovah's Witnesses reveals that 33% report suicidal thoughts and 10% attempt suicide, with those experiencing childhood religious indoctrination showing more severe neurological symptoms. Women demonstrate particularly high trauma levels due to additional patriarchal control mechanisms. Evidence-based treatments must address specific neural dysfunctions. Eye movement desensitization and reprocessing proves most effective by promoting bilateral brain integration and memory reconsolidation. Somatic therapies address trauma stored in the nervous system, while cognitive behavioral approaches strengthen prefrontal cortex function. Neurofeedback shows promise for directly training healthier brain wave patterns, with mindfulness practices producing documented structural brain changes supporting emotional regulation. Recovery requires systematic neural network rehabilitation. Phase-based treatment approaches mirror natural recovery timelines. Initial safety and stabilization to normalize stress hormone function, followed by trauma processing to reintegrate memories, and finally integration work to reconstruct healthy identity systems. Social reconnection proves crucial for reactivating dormant social brain networks and mirror neuron systems. The economic impact of religious exit compounds neurological stress through financial insecurity. Many ex-Jehovah's Witnesses lack educational credentials and job skills due to organizational discouragement of higher education and career advancement. The stress of financial survival, while simultaneously processing religious trauma, creates additional neurological burden that impedes recovery. Vocational rehabilitation programs specifically designed for religious trauma survivors address these economic stressors while supporting neurological healing. Career counseling, educational support, and job training reduce financial anxiety that interferes with trauma processing. Some programs incorporate neuroplasticity principles by timing educational activities during optimal brain states for learning and memory consolidation. Research on post-traumatic growth reveals that many religious trauma survivors eventually develop enhanced psychological capabilities. This phenomenon occurs through neuroplastic adaptations that strengthen executive function networks damaged during indoctrination. The necessity of reconstructing identity and belief systems from scratch creates neural flexibility that exceeds normal population averages. The development of specialized assessment tools for religious trauma represents a critical research need. Current diagnostic criteria fail to capture the unique features of religious trauma syndrome, leading to misdiagnosis and inappropriate treatment approaches. Validated instruments must assess specific neurological symptoms including cognitive rigidity, social pain sensitivity, identity confusion, and spiritual injury. Professional training programs for therapists working with religious trauma must incorporate neuroscience education alongside traditional clinical skills. Understanding the neurobiological basis of religious indoctrination and exit enables more effective treatment planning and realistic expectation setting. Therapists need specialized knowledge about high-control group dynamics, cult psychology, and the unique features of religious trauma to provide competent care. Prevention efforts targeting vulnerable populations could reduce the incidence of religious trauma. Educational programs teaching critical thinking skills and cult awareness might create cognitive resilience against manipulative recruitment tactics. Early intervention programs could identify individuals at risk for problematic religious involvement before severe neurological damage occurs. The neurological impact of leaving Jehovah's Witnesses represents one of the most complex trauma syndromes documented in neuroscience research. The systematic exploitation of neuroplastic mechanisms through prolonged psychological manipulation creates measurable changes in brain structure and function that persist long after exit. However, the brain's remarkable capacity for change becomes both the mechanism of harm and the pathway to healing. Understanding these neurobiological processes transforms how we approach religious trauma recovery, from viewing it as simply a psychological adjustment to recognizing it as a neurological rehabilitation process requiring specialized, brain-informed interventions. The research provides profound hope, While leaving high-control religious groups create significant neural disruption, targeted therapeutic approaches can not only restore normal brain function, but often enhance cognitive abilities beyond pre-trauma baselines. This investigation underscores an urgent public health need for mental health professionals trained in religious trauma neuroscience, specialized assessment tools, and evidence-based treatment protocols. The millions of individuals affected by high-control religious groups worldwide deserve care informed by our growing understanding of the remarkable neurobiological journey from indoctrination through liberation to psychological freedom. Sarah's story, repeated countless times across the globe, represents not just personal tragedy, but a call for scientific understanding and compassionate intervention in one of humanity's most complex psychological phenomena.